February 26th meeting of the Portland Children's Levy Allocation Committee. I'm City Commissioner and Allocation Chair Dan Saltzman. With us today are my fellow committee members. On my left is Multnomah County Chair Deborah Kafori. Seated next to her is Serena Stoudemire-Wesley, the Multnomah County Public Representative. On my right is Julie S. Young, and she is the city-appointed public representative. And on my far right is Mitch Horniker, representing the Portland Business Alliance. Our staff of the Portland Children's Levy is here as well. Lisa Pellegrino, Meg McElroy, Lisa Hansel, Mary Gay Broderick, John Kelly, and our newest addition, John Coughlin. So before we get started, let's approve the minutes of our October 2nd meeting. I'll entertain a motion.
So moved.
Okay, moved.
Second.
Second, okay. All in favor, say aye.
Aye.
Okay, our minutes are adopted. And as usual, our next step is we do have time for public comment on items that are not on the agenda. If you're here to speak about an item on the agenda, you can do so at that time. But if anybody wants to give us a piece of their mind on something else, we have time set aside at this point in the meeting for public testimony. Does anybody wish to give any general comments to us, testimony? Okay, I don't see anybody. As I said, we will have time on our agenda to comment on other things. And I also wanted to announce at this time that the Portland City Council has formally placed on the May ballot of this year the renewal of the Portland Children's Levy. We are what's called a local option tax levy, so that means by state law we have to be renewed every 5 years in order to keep going. So the City Council did vote to place that on the ballot, and so you will be seeing Measure 26-197 on your May ballots. We'll begin by hearing from staff today who will walk us through the levy's annual data report. So we welcome them, and they will provide us highlights for us.
All right, good afternoon. I'm Meg McElroy, Assistant Director with the Portland Children's Levy, and I will walk you through a high-level summary of a 43-page report that you all were provided with, and it will be on our website if it's not already, that covers data from the past year of levy operations, as well as looks at 3-year average performance, so the last 3 years of the current levy. The report is framed to look at sort of what we expected to have happen, the results that actually did happen using data collected from grantees, and sort of the implications of those data compared to our investment goals, and looking at different performance metrics that we use on an annual basis across all levy grants as well as individual program areas. The slides that I'll cover with you today look at specifically the levy-wide progress. If you are interested in program area data, that is in the longer 43-page report. And we collect a lot of data, so in the interest of brevity, we're keeping this at a levy-wide focus. Another thing I wanted to bring to everyone's attention is the amount of work that gets done by grantees to collect these data. So grantees use their own systems internally to their organizations, to their programs, to provide us with data that we agree to what they'll provide in grant contracts, and they collect that and report it to us on an annual basis. Then we as a staff internally aggregate that, analyze it, and put it together in this report for you. What that all should tell you is that we don't have a large database into which all of these data are going on a per client, per child, or per family basis. So there's a limit to some of the analyses and some of the sort of things we might like to know based on the way in which we collect these data. But grantees do a lot of work to supply what becomes the information in this report for us. Just a quick reminder that the data that we're going to look at are to help us gauge success toward the 3 goals that were set by this committee in advance of the beginning of funding decisions and grant funding in this current levy. So when you all were getting ready for that process in 2014, the following three goals were adopted by this committee, informed by an extensive public input process. And those goals are prepare school for children, support their success inside and outside of school, and reduce the racial and ethnic disparities in their well-being and school success outcomes. Toward those goals on the last slide, you also set two sort of access goals in terms of trying to help reach services to those who have been historically underserved and marginalized in our community. So those access goals were to invest at least 30% of our funds, the levy's funds, in culturally specific services, as well as across the levy, and as well as in each program area, and to increase the access to services in East Portland. So based on data collected this past year and over the past 3 years, the levy has achieved those two goals. Currently, 35% of funds are invested in not currently. In 16-17, 35% of funds were invested in culturally specific services, compared to a 5-year average of 31% in the previous levy. The only program area for which the levy did not meet its goal of 30% of its funds being invested in culturally specific services is in the hunger relief program area. So as the levy looks to priorities and work in its, if it's renewed by voters, it will want to, I think, revisit that question, and we'll talk a little bit about that later in the presentation here. The levy also increased access to services in East Portland. In the previous 5-year levy, 38% of children served resided in or attended school in East Portland, compared to most currently in 16-17, 45.3%. So we've seen an increase.
You know, we're using, is it 82nd Avenue that's the boundary?
Yes.
What we consider East Portland? Primarily,
yes.
Okay.
And there are 5 zip codes specifically that we look at in terms of where the location of the school or where children live.
Okay.
Do you need those zip codes? Okay.
Okay.
So this past year, in 16-17, there were over 11,000 children served by the Children's Levy grantees. That exceeded the projected number of children to be served by about 11.8%. Oftentimes, projections are exceeded when there are large programs that may have a drop-in service or a single point-in-time contact, where it's a little bit harder to project how many kids may take you up on the offer of that service, as compared to a relationship-based longer-term service, where those projections are a little bit more accurate, unless there's high turnover. The majority of children served were from low-income families, so we're defining that as 185% of the federal poverty level or less. About a third were from homes where the primary language spoken is not English. Most of those are from Spanish-speaking homes, but about 10% of children served by the levy speak one of about 50 other languages. Over 70% of children served identified as a child of color. That's an increase from the previous levy, where the 5-year average was about 64%. But on average, these figures currently are very similar to the previous 5-year levy. One other thing to note with these data that I just covered on this slide, in the next few slides, they don't include the children served in hunger relief programs. I'll talk about those separately toward the end of the presentation. So the next thing we want to look at is what we're calling service access by race and ethnicity. It's trying to understand how well levy-funded services reached children in our community as compared to how they comprise school enrollments across the Portland area. So this graph that I'm going to show you, think of it as a sort of 2 side-by-side pie charts. The first column represents the race and ethnicity data, identity data reported for all children served by levy-funded programs, and we want to understand how well that reflects the population of children that are enrolled in schools in the greater Portland area. So we look at these data on an annual basis to try to understand how well we're reaching the children in our community. We would expect that at a minimum, there should be parity. Those two columns should be proportional. However, because the levy is trying to reduce racial and ethnic disparities in children's outcomes, we as the levy would like to see our column be higher in its numbers than what the school enrollments look like. We want to be reaching more into a more diverse population than what the school is, in order to help give greater access to populations of children who have historically experienced negative outcomes. So when we look at this slide, what we should take away from it is that there are places where we are reaching. Similarly, there's parity between who's enrolled in the public school system in our community and who the levy is serving, and some areas where we're reaching sort of a greater portion of the population by comparison. There are also some areas where we see a little bit of difference where we need to do better. And I should have clarified sooner. I don't know if you all want to take questions as we go or at the end, but I'm happy to do either one. But I'll keep going.
Yeah, if anybody's got questions, they can just
chime in.
Ask as they want to. Yeah.
Okay, thank you. So the last slide sort of showed us, looking at children specifically, the access to services, how well are children in our community reflective of the school population. Now we're going to look at how well do the children and families who enter levy-funded services stay for a period of time that we're looking at as likely to produce the positive outcomes that we want from the service they're in. So this is more about completion of a certain amount of service. We refer to it as minimum dosage. It's the amount of service that a grantee program anticipates is necessary for a child or family to complete in order to achieve the outcomes that they're measuring in their program. One thing we look at as part of this is what we call early exits. It's the sort of percentage of the kids and families served who left the program before really ever engaging, when that's usually like 3 months or less. So in this current levy, the 3-year average of early exits is about 7.5% of participants have left before really engaging, compared to 8.8 in the previous levy. So there's a small improvement there. And then the percentage of children and families who have reached sort of what we're calling that minimum dosage or completed a certain amount of service that we expect to produce positive outcomes is 80.7% compared to 66.6% in the previous levy. So we've worked with grantees to pay a lot more attention to this particular metric, so I think that is the biggest sort of reason why we've seen it increase over time.
Can I ask a question?
Yeah.
So I noticed in the previous one, you included Slavic with white, but in this one you broke out the
Yep.
African in this one. Can I ask why the difference?
Absolutely. In the previous slide, those things are grouped together because that's how the school district does their data, and so the only way we could compare ours and theirs was by trying to make them as similar as we could. But because we collect our data down to those more disaggregated levels, when we're looking at only the kids who entered levy services and then how much service they completed, we can look at those at a finer grain.
Okay.
That's a great question, and the other important thing to keep in mind as you look at these two columns of data as compared to the previous slide is that when we talk about this first column, participants enrolled in levy-funded services, that includes parents and children. In the previous slide, we were only talking about all the children served. In this one, we're talking about families and children for whom outcomes are measured, and you have to complete a certain amount of the service to get an outcome. So we fund some services like CARES Northwest or a drop-in childcare at the Gateway Service Center that we don't necessarily expect an outcome to occur. Those are a one-time only service based on design. So that's about 1,400 kids for whom they are not included in this first column. So that's kind of what I'm talking about. And then there are some services that we fund where the family, like in child abuse prevention intervention, the parent, for example, is sort of the key beneficiary, and what you're working on with that child and family is in part what's happening with the family. So these demographics are a little bit of a blend of children and family, and they're more of our relationship-based longer-term services. So the first column is kind of everyone who walked through the door, so to speak, enrolled in the service and was eligible, could complete a service and be measured for outcomes. And the second column is everyone who stayed in long enough to do that. So we would want these columns to be similar, and we would want to see that there's parity between kind of who walked in and who stuck around over time. And the good news is that there is, for the most part, parity in all of our populations. There's very little where we're having a population walk in and then sort of having retention issues over time. So we're encouraged to see that. Any questions on that one? I know it's a little bit complicated on the technical pieces. So outcome goals. Each grantee has by contract agreement with us, a number of outcome goals that they track. And so one of the key things that we look at is whether or not they met their outcome goals. And a way that we aggregate all that data up to make sense of it and report it to you all is to talk about the number of goals met by program area or across the levy. So what I'm about to talk about is about the number of goals, not the number of kids. We also look at the number of kids who met given outcomes, and we look at that more by program area, because by program area there's more similarity in the types of services we fund. Therefore, there can be more similarity in the types of outcomes tracked across children or a given population. But for the sake of this slide, to look across the levy, we're talking about whether or not outcome goals by any given program were met. So for example, on this slide, you can see the different types of outcomes that are tracked by programs: child development and health, parenting practices, family function. But we're really trying to understand how well our outcome goals met across the levy. So out of about the 190 outcome goals tracked collectively by all the programs funded, about 81.4% of their goals were met. That's a decrease compared to the previous 5-year levy average of 87.8%. But there were 25 new programs funded in this current levy in 2014, and oftentimes new programs take a little bit of time to get up and running and figure out their data tracking methodology and whether or not they projected correctly how many kids or what percentage of kids would meet outcomes. So in digging into these data a little bit, for example, the 3-year average of outcomes met by new grantees, so new to levy funding, was 74% compared to 84% for grantees who had been with us for a while. So you can see that sort of that 25 new, that there is a little bit of uptake in the beginning there. Another thing to keep in mind with these numbers is that, so like I said, each grantee has to track their own number of outcomes or their own type of outcomes based on what they're trying to accomplish. And their outcomes typically look something like X% of kids will achieve and whatever you're interested in measuring. So in early childhood, for example, 90% of children will be on track with developmental milestones. Well, if they only had 89% instead of 90, we count that as not met for the sake of this measurement. So one thing to keep in mind when you're looking at sort of a decrease from the previous levy period to this period is that there could be outcomes for given programs where they were off by 1% or 2%. But to put this together for you all today and for us to make sense of it, there are little technicalities in how we track the data that influence these figures. Anything else on that one? All right, so another metric that we look at to understand progress is staff turnover in the programs that are funded through the levy. Because so many of the programs that are funded are relationship-based, it matters that staff have a consistent relationship with the children and families that we serve. And the 3-year average in this current levy of turnover is around 21%, which is up from the previous levy slightly, though the range has been about 15% to 20%. So it's not completely out of range, but it's a little high. It also varies by program area, which is in the larger report we put together. One thing I think that's really important is that our data don't track things like whether turnover is the result of promotion, retirement, somebody leaving to pursue higher education in the type of field that our grantee programs operate in. So we don't have rationale for why people leave. So it's hard to make a lot of sense of some of these data. One thing I can tell you is that the levy funds a lot of entry-level jobs: after-school teachers, preschool teacher assistants, home visitors. Those are jobs that in our economy are going to experience some level of turnover because people are going to be promoted because they're good at what they do, or they're going to decide to go back to school to do something differently or with higher responsibility in their field. So there is some turnover I think that we can expect. I don't know that this number would ever get to 0, but I think it's an important thing for us to keep our eye on. One highlight I think that's for all of us worth noting is that in the child abuse prevention intervention program area, it experienced an all-time low turnover rate. For the past several years, the range in that program area was 23 to 30% of staff turning over on an annual basis. And this year it was only 14.7%. So we're feeling encouraged by that. It could bounce back up next year, we don't know, but I think we should celebrate a victory like that. Any other questions on that one before I move on?
Will you remind us, I know that we had taken some specific measures in the past few years to work on this in particular.
Yeah.
Can you remind us what
Yeah,
those
yeah,
were?
absolutely.
Thank you.
We paired mental health consultants with home visiting programs and offered them training series as well as on-site consultation around workplace wellness. So it consists of trying to encourage their use of trauma-informed practices to take care of themselves in their work that's highly stressful, to equip them with more skills to handle the stress of the families that they serve, and to work better as a team in light of those situations, and also to equip their supervisors with more skills to help navigate all of that. So the programs I just mentioned to experience lower turnover do happen to be involved with that effort. We don't have data that sort of says this caused this, but it looks good, so we feel encouraged.
Thank you.
Yep. All right, so looking specifically at the hunger relief program area for a little bit. So this one we pull out differently because of the way in which it operates compared to the other program areas. The other program areas have outcomes because of a relationship-based service happening over time. This is more transactional, where you're trying to provide a basic need to a family as opposed to measure an outcome of behavior change or skills or knowledge acquisition. So there's also probably a great deal of interconnection between the children served in the hunger relief program area and the children served in all of our other program areas. We don't know exactly because we don't collect child level data, so we can't say, we know that this child was involved with these 3 grantees. We don't know that. But the 15,000 children that were served in hunger relief probably do have some interconnection with the 11,000 children served in our other program areas, because many of those programs in our other program areas are referring to these services as well. So food pantry services comprised, of the 15,000 children served, over 3/4 of them accessed the food school pantries that are funded through the Children's Levy, and the other quarter accessed the other emergency food resources that the Levy funds, which includes home-delivered meals for families who have barriers to transportation and being able to access food pantries, the summer lunch program opportunities, and then also food donations from partner organizations and whole food assistance for purchasing whole foods like fruits and vegetables. One thing we did note in looking at the demographics of children served in this program area is that there were a lower percentage of African American children served in this program area compared to their enrollment in the Portland area schools. So we'll talk a little bit again at the end of this presentation about these data implications for going forward, but certainly something for us to dig into there. Just some highlights from this program area. So 2 grantees provided key resources at schools where there were no pantries. They were engaging partners they work with at those schools to provide fresh produce and prepared foods at that site. The program that we fund that provides delivered meals was in high demand for parents who have chronic illness or either their children or parents have chronic illness, and so they lack access to food pantries and other healthy food options, or they have significant transportation barriers in order to access food. There was also very high demand for the Village Market discount food program that the Levy helps fund at the New Columbia housing community. So that program helps families access fruits, vegetables, whole grains, and other healthy food. So last but not least, sort of the implications of these data looking forward. We hope that a lot of the access data that we looked at will help us understand where we should focus our energy, help us focus our energy on the public engagement to inform future levy funding. So should the levy be renewed, those access data that we were talking about, sort of where we aren't really reaching some populations, particularly hunger relief and the African American population, we hope that our community engagement process, which you'll hear about today, later in this meeting, would help dive deeper into what we should be doing for any given population to increase their access to levy-funded services or to address their needs through levy funding. Another population that merits some looking into, I think, in our public input process will be children with disabilities. About 5% of the children served by the levy among those who reported that data indicate that they are children with disabilities, but CDC data typically says that there's around 13% of a national prevalence rate of children with delay and disabilities nationwide. So we don't collect those data from every single grantee. It's not a required piece. We don't really know how far off we are. But I think we're far enough off, and we haven't ever funded services necessarily directed specifically for children with disabilities that our public input process should look into that as well. Other questions or things you want to know?
The child care initiative seems has really good results, more children served than we had anticipated. And so at some point, as we're talking maybe around our next funding strategies, to talk about this, obviously it's meeting a need in the community, and as we weigh the services compared to others, I think having more conversations about that.
Yes, in a future meeting, I'd like to bring more data back on that particular project, just because we did have, so in the 43-page report, Chair Kafoury is referring to, there's a section in there that talks about our community child care initiative, which you all also invested additional funding into. So it should be serving, I think, within the next, by the time we get a new annual report from it at the end of July, it should be serving close to 200 children annually with access to high-quality, affordable childcare in our community. But we did a survey with families who've already been participating in it, and there are some data in the 43-page report that you have that talk about some of the things that they feel are benefiting by. We also surveyed providers, though we didn't get a great response. But I'd like to put together all of those data that we have, remind you what we learned from the previous version of that, and give that to you at a future meeting, but there wasn't time to put it all together for this,
Perfect.
piece.
Thank you.
Yeah, sure.
Any other questions? Okay. It's a great report.
Thanks.
Good data.
Yeah.
Thank you.
Thanks for your good questions.
So our next item is we're going to hear from staff about their rationale for 3 grant renewals, 2 for Self-Enhancement, Inc., in the funding areas of after-school and child abuse prevention intervention, and 1 for NEA in foster care. You may recall these grants were conditionally approved a year ago, and at that time, members of the allocation committee wanted to check back with staff to review the outcomes and other data issues before deciding whether to continue these investments for 2018, 2019. Turn over to Lisa.
Yeah, it's
Lisa's.
the 2 Lisas. This Lisa over here. Pardon my voice, still a little bit of a cold. I wanted to check in with you all. Thank you for the introduction. Actually, that was exactly what I was going to say, is that you just needed to make a decision about whether to continue these grants for that final year because you did a conditional renewal. We sent you all of the data on the grants for the 16-17 year. That was in your big notebooks with all the individual summaries. And I'm not sure if anyone's got any particular questions. Staff is recommending they be continued because in all cases, all the grantees met either all or some of their outcomes in this year of measurement, and that was the primary concern. In addition, all the rest of the data on the grants looked fine. They're serving the amount of people that we expect them to serve, and they're participating at a level we would expect. So there were no other performance concerns that would lead us to recommend that we not continue funding. So I'm happy to answer any questions, and if you have any questions of the grantees, we could do that as well. I'm just not sure where folks are on it.
Okay. Committee members have any questions? Okay.
Sorry.
Yeah.
Are you recommending that we do further monitoring? I don't know what level the monitoring occurred during this year, but during this next year of the funding, if we vote today to continue? This is very weird seeing yourself on that.
It's distracting, huh?
Yes.
Yes, in particular, so for all of the service monitoring, so that to know what's happening around service and participation, that can be ongoing, and I know that Lisa is monitoring hers quarterly for that. Okay. The issue with the contract that I monitor, the SEI after-school program, that's an outcome data collection issue was the problem, and they managed it very well last year and did an excellent job. And I've checked in with them at this the midterm interval to make sure that that was still in place and happening, and it's all systems go. Okay. So I'm not anticipating any problems, and I will check back again when those outcomes are measured annually because they keep kids in service for the entire year. So there's not progress on that because they're not measured till the end of the year. So I check in around the time that that's going to happen and make sure that there's no problem with that. So yes, that is ongoing and will continue. Is there anything else you have to add to that? Or?
That's
okay. Okay.
Okay, why don't we see if anybody wants to testify? Or anybody want to testify on these items of contract extensions? Okay, seeing none, then I guess Did you have further information on these contracts to present? Okay.
I have
Then
a
guess-
question. So, is the goal to make sure that all of them are completed with the ongoing monitoring? I guess that's really my concern, because both of these programs are experts in their field. So I guess the expectation should be that all of their goals should be met at the end of the biennial or at the end of the program.
Well, we will certainly report back to you when they report. They only report outcomes on an annual basis, so we don't have any data on that currently. We will have that data at the end of this fiscal year and be giving that to you as we would normally do that, so you'll have a chance to assess that again.
Okay.
If that makes sense.
Okay, then I guess we're ready to vote on these 3 contract renewals, or extensions, I should say, contract extensions. 2 for Self-Enhancement, Inc., and 1 for NEA. I'll entertain a motion on those items.
So moved to continue funding.
Okay.
Second.
Okay, moved and seconded. All in favor, say aye. Aye. Opposed? Okay, great. Thank you. And then our last item today has to do with our planning and public involvement around funding priorities and strategies for the next 5-year children's levy. Staff has done extensive research in this area and around the advantages of hiring an outside consultant to design this community engagement process. So once again, I'll turn it over to Lisa.
Lisa's going to handle
Oh,
this.
Lisa
The other
Hansel
Lisa this time.
Okay.
I'm just here for decoration.
Thank you. To frame this discussion, I'll start with a brief overview of what public involvement is, then recap the October 2nd discussion on this topic, move on to describe the additional information that has been gathered since the October meeting, share staff recommendations, and then open it up for your discussion. Public involvement is a process in which members of the public who are most impacted by a planned government action participate in the decision-making about it. The city believes that government works best when it partners with the community, and having a public involvement process that is effective is a critical piece of that success of that partnership. Some of the benefits of public involvement include decisions that respond to the needs and priorities of the community, provides an opportunity for community members to be part of the solution. Community members feel heard and valued in the process. It increases public understanding of policy and programs in the community, and it also builds trust and increases accountability of government actions. I've reviewed these principles to assure that there is a shared understanding of what public involvement is and why it's important. Any questions or discussion before moving on to the next piece? At the October 2nd meeting, we shared with you the goals of the 2013 Public Involvement Plan, and since not everyone was able to be present at that meeting, I'll review those goals now. First, to promote an understanding of Portland Children's Levy funding process, services funded, and demographics of the children and family served. Understand perspectives from diverse stakeholders about the most effective and most needed services for children, especially children most affected by historical inequities. And third, to cultivate positive relationships with traditionally marginalized populations. With those goals in mind, we sought input on the following topics: overall goals for levy funding, division of levy funds among the program areas, and policy goals and recommendations in each of the funding areas. We also asked about needs and gaps in services, and also in systems issues, and gaps in for populations and geographical areas. We also asked about equity issues, specific requests for investment issues, like what questions should be asked and what information would we be looking for. And then also we asked for evaluation and feedback on our community input process itself. In addition to providing information about the goals of the last public involvement process, we talked about the background of how public involvement was done in 2013, the kinds of methods that we used. We talked about the major themes that we heard from people, and we also shared feedback about the process itself. And to remind everyone, the 2013 public involvement process was designed and implemented entirely by PCL staff. We received lots of information from service providers and stakeholder groups. However, the engagement with and responses for community members was limited. Some allocation committee members, as well as other stakeholders, have expressed concerns about the missing voices in the public input that we received the last time, and staff shares those concerns as well. In response to that feedback, staff recommended that the committee consider contracting with a consultant to lead the next public involvement process. Per your direction at that October meeting, staff has done further work and consulted with several government entities regarding public involvement projects that were completed in partnership with consultants. We reviewed the purpose of each of those projects and the scope of work that was completed, the timelines, costs, et cetera, and we provided you with a summary of those projects that we reviewed last week. Before I move on to the staff recommendations, do you have any questions about those projects, the summaries that you received on those projects?
Could you, I confess I didn't see that. Could you just run through the projects? Just give us the
Sure,
name.
just quickly, we looked at some city projects through the Mount Hood Cable Regulatory Commission and the Housing Bureau and Parks and Rec. We also looked at one county through the Health Department. We looked at Metro, and we also looked at the Oakland Fund for Children and Youth, which is similar. We've talked about them in the past, and they're similar to the Children's Levy. And in each of those projects, they were looking for input around either specific plans that were in place and or looking for recommendations about how funding would be used. So that's generally the purpose of those projects that we looked at.
Thanks.
Any other questions before moving on to recommendations? Okay, so after consulting with these representatives from the other government entities, staff continues to recommend that the levy engage a consultant to lead the design and implementation of the upcoming public involvement process. And we recommend this for three primary reasons. First, to reach and engage youth, parents, and community advocates from diverse communities, we feel like we really need to work through entities that have established relationships in those communities. Additionally, a contractor can provide expertise and additional capacity to implement some of the more time-intensive and rich methods for gathering input, for example, focus groups and interviews. And last, a consultant brings neutrality to the process, and we feel like we get more direct and honest input and feedback. So if the committee chooses to engage the services of a consultant, staff recommends that we start the request for proposal process as soon as possible so that the work can begin in the event that the levy is renewed in May. Staff would recommend that up to $100,000 be allocated for this purpose. That would include the consultant and any sub-consultants that were working on the project. And we estimate that the project would take about 4 to 6 months based on the input that we received from the other projects. So that's the end of the presentation on this, and if there are any questions, happy to answer those or move forward with your discussion.
Any discussion or questions of Lisa first, I guess?
No questions.
Okay, any discussion about moving ahead?
Yeah, I would, there's just a couple things that I'd like to throw out to include in specifically what we asked. I'm in favor of this, and thank you for doing a very thorough job and showing us some other programs and divisions of county and city government that have taken a stab at this. I think it's a good idea, but I also think it's an opportunity for us to not just to think a little broader on a couple different fronts. I would be very interested in both public and grantee comments on at least 3 specific areas of, as I looked at our results. I would like to engage in a broader, deep discussion on grantee turnover, staff turnover, It is a problem that plagues social service, but that doesn't mean that there aren't things we can continue to do, and especially with the evidence that we have seen from our investing in support for our most heavily asked people on the front lines of child abuse and prevention. Also, as I look at our after-school and mentoring programs and the benchmark testing and graduation rates that are extremely underwhelming when compared to all PPS, which compared to their state and federal cohorts are extremely underwhelming in themselves. And I wonder if our grantees and the public would have any ideas that would help us work towards bringing those up. Also following up on what Serena said, essentially we're having 2 out of every 10 of our goals not met, and a discussion about whether that is good, bad, or indifferent, I think would be very helpful for us. And then finally, I think it's an opportunity for the public and grantees to provide feedback on us and staff in a way that they don't normally have. So I would like us to be able to utilize an outside group to include those in accomplishing what we're trying to do. And even if it meant spending a little more money, I think it would be worth it as we go forward and try to improve our outcomes.
So I guess my question is this the same sort of consultant that would do the public outreach that would also sort of drill down on the questions you just asked from a consultant?
Well, I'm looking at our the bullet points on the topics for input list, many of which are broad, but some of them are seemingly specific enough to fall into that range. And so the reason I threw in the last part about I don't have any baseline to know what $100,000 will buy, but if it costs a little more for them to get a little more grounded on our existing programs so that they are competent to ask the questions that are on your list and the one that I just gave out, I think it would be a valuable use of our resources.
Okay. Any other discussion? So I'm not sure what the consulting market looks like myself in terms of public involvement. I know there's a lot of players out there. I'm just thinking in terms of issuing a request for proposal, we have to have some sort of an estimate of how much money we're willing to spend. And so in response to some of the issues Mitch just raised about, is this going to cost us more? I just don't know. By the same token, I don't want consultants necessarily to pass us by because they don't think there's enough money available given the work we're asking of them.
So could we increase the amount from $100,000 to maybe 150 to 2? Would really, to get all that Mitch has said that needs to be done? Because I think it's about accountability and working with these programs and then really drilling down to get what we need to better understand not just accountability for the organizations, but also accountability for us too as well, being good stewards over our taxpayers' dollars. So, yeah.
I mean, that's fine with me. I mean, usually when we put on an RFP, we do it not to exceed, and then you see what comes back, and people have to drill down on their costs because they have to submit a budget that's part of the RFP process. And so the budget is pretty detailed typically. It's like a certain amount of people doing certain activities at this cost, and so it allows you to decide or I should say, the folks who are ultimately going to evaluate the RFP, what services do we really want to make sure we have, and do we feel this is a good value for what is proposed? And, how does that compare to what someone else proposed? Right. So there's some level of incentive for people to, try to put their best foot forward and describe the best deal so that they get the RFP, but to be able to get the job done
right.
as well, right? So we're, the evaluation process is trying to look at both of those elements. What's a good deal, and what is, can we be sure to get all of the work that we want, and, sort of a robust set of methods, because I feel like that's where particularly the staff-driven process has not been able to deliver on the different types of more time-intensive methods. The other key piece is, I think, as Lisa pointed out, having relationships in communities that you want to get input from is key, and likely they'll need to be subcontractors to be able to do that. And I'm not sure that any one organization has got that kind of bandwidth. So we would expect that would be likely to come back for us. So we have no objection to increasing the resources, and if you want to particularly add some of these items, I mean, some of these things I think will be covered in what we described and what we would talk about with them, but I think if you want some more detailed feedback on sort of committee staff, how, that might be, maybe that's something separate than what we were originally anticipating, which is more around need, or what are the solutions you see in your community for the problems that you want addressed, those kinds of questions. So we have no objection. I'm not sure how you all feel.
I can speak to this, since Multnomah County, with our community health improvement plan, hired a consultant, and they hired subcontractors in culturally specific organizations to do these really intense, the time-intensive things that both Lisas were talking about, doing focus groups and community engagement by people who are trusted within their community, so that the community members feel more comfortable coming forward with their thoughts, questions, concerns. And it was really effective. We engaged a lot of people, and it was a community building exercise in addition, and then the community everyone that I heard from felt really good about the process that they were involved in and the outcome. It was very intensive, and we spent $200,000 a year. I don't know, we may want to say 150 for this project. I don't know what people are thinking.
The information, if you're referring to, is this mic on? Yeah, I guess.
Yeah, it's on.
The Multnomah County one, is that the same one that is mentioned in our notes that we have from staff?
Yeah.
But that, it appears to me that was meant over several years. That it may have been more intensive than, I certainly stand in favor of that we should be willing to budget the amount of money we need to have a really good product. I'm looking at the information we were given about the Oakland Fund for Children and Youth, and which to me would be a fairly good comparable, and that was for a year, $100,000. So I think that it seems to me that $100,000 to $150,000 would be, especially if we're talking about 4 to 5 months. We don't want to spend a whole year or two on this, I don't think, because we need to make decisions a little more quickly than that. So, but I absolutely am in favor of going this route. I agree that the neutrality and that this would bring to the process is very important. I think we'll hear from people in the community who perhaps have been somewhat reluctant to speak up. I think it's challenging at times for current grantees to be judgmental or to give input when they may feel that this may have an impact on their ability to be funded. So I think it's a really good idea, and I hope that we can move forward on it. I agree to be ready to go. I'm hopeful and confident that the levy will be renewed and that we can have people working on this, June 1st.
Okay. This seems like a good point to ask if anybody from the public wants to share their insights on this question with us. I see a show of hands. Anybody wish to comment? Okay, well, come on up. Well, come on. You need to speak to the microphone, and you need to give us your name.
I'm Joseph Teets from Pathfinder, Oregon. I would just reiterate what folks are saying. I think the diversity of how the questions are asked in the forums is particularly crucial when you're trying to get some of these more marginalized populations. We know in criminal justice it's a real bear, so there is some sort of investment in figuring out different strategies and approaches to get at those voices.
Okay, thanks, Justin. Anybody else? Okay. Well, I think I would be comfortable with something maybe in the $150,000 range, so maybe changing the not to exceed
To 150 instead.
to 150.
Are people comfortable with that? I mean, again, you don't have to choose, you can see what, we'll see what the options are. It's not saying that we're going to spend that much, I don't know. It depends on what people propose, and is it rationalized, in what they propose. So I think there's no harm necessarily in extending that ceiling, and if you don't use it, you don't use it.
Right. I think it's better to come out right the first time than having to go back and redo it again, so.
Definitely.
Also,
Especially given time
as we said a few times, if we're going to ask, or we're going to expect subcontracts, that's going to increase the amount of the overall contract, so I think it would be
And that
money
could
well
well be.
spent. Yeah.
Okay. So I guess we're ready to vote on this, and you're looking just for a straightforward approval to issue an RFP for public involvement, not to exceed 150,000?
Yes, we just want because we have to be able to put that out shortly in order for, that's a whole process we have to go through with the city, and so that takes time. And in order to give people time also to make sure it's circulated well in the community, so we hopefully get a good response and from a variety of people. I mean, also, if people are going to work with subcontractors, that also takes time. They got to figure out how that's going to work. So, so we wanted to make sure we left enough time to get a good proposal, to your point, Serena. So that's why we want authority to be able to put that out there, because that process will take probably 6 weeks, I think, to conclude.
So will this committee see the draft before it gets finalized and be able to provide input on it, or how does
Sure,
that
if you want to.
process work?
I mean, normally, that's something that staff would do, and then we have to put that through city procurement. We have to work with them on this. But if you want to see a draft proposal, we'd be happy to circulate that if you want to give, I think it would work better if you gave written comment, or if you want, or I guess we could do it over the phone, but sometimes it's helpful if you have particular ideas that you want in there, then we could do that. Does that seem reasonable?
Yeah.
We should be able to, I mean, we've been working on something, just to make sure we have ready to go, so we should be able to get something to you in the not too distant future.
Great, okay.
Yeah, because I thought, Mitch, you raised some really important points that I'd like to see in there as well.
Okay.
So do we need to amend anything to reflect Mitch Hornicker's points that he raised, or staff understands?
I mean, we're happy to carry that out, and we'll send it to you. If you can make that part of the vote, I guess, if you want.
Okay. Well, then I'll entertain a motion to approve issuing an RFP for public involvement for Portland Children's Levy.
So moved.
Moved?
To
Second?
to include Mitch's suggestions or recommendations.
I spent a bunch of time with Lisa.
Yes.
She knows,
Okay,
she knows what they are.
all right.
Okay. All in favor, say aye. Aye. Opposed? Okay, go forward and do good things.
All right, great,
So
thank you.
thank you, everyone. We have yet to schedule our next meeting, but it will be posted on our social media sites, and an agenda will be sent to the database. So we stand adjourned. Good work.